Hi, everyone. Today we're going to talk about critique of the literature. I'm Dr. Kate Stiller, and I'm going to give you a few pointers. We'll discuss the importance of critiquing literature as DNP researchers and describe guidelines that are commonly used to critique research literature. We'll discuss other methods that are recommended by experts such as Allison Terry for critiquing a research article. We'll choose a method to use for critique of research articles while in this course. So it's important for you to develop your own methods and a system that you just do every time that you review a research article that you intend to include as a part of your research. Do recognize that bad research does exist. I don't know how it gets out there, but it's there, and you have to have a scholarly lens to look at it and know that hey, this is bad research. So, in collecting literature, let's think about that for a moment. You're going to begin to collect literature because you've identified a research question of interest and you need to find out more about it. So once you identify this passion or this area that you want to focus on, begin to do a cursory literature search. Start snooping around. And you know you're going to have to experiment with the particular library that you're using and develop some sort of system based on the way they have their library arranged for obtaining, collecting, and organizing articles of interest. And if you need to, most libraries, online libraries, have a orientation slideshow that you can look at to help you get started. And you know, it takes more time initially until you get into the swing of using that library, and especially in entering keywords in your keyword search and narrowing down your search and doing a more advanced search so you only get certain articles, for example, in the last 5 years and that sort of thing. So as you obtain each article, you should have a system that you develop to critique the contents of the research article. First of all, is it a research article? Students get very confused about this. There's lots of articles that authors write where they draw on other studies to make their point. That's like some of the term papers that you've written. That's not what you're looking for. You're going to be looking for articles where the author studies the same variables that are of interest to you. For example, if you want to study the effect of, let's say, acupuncture on chemotherapy-induced nausea, then you should have studies where others have looked at the impact of acupuncture on chemotherapy-induced nausea. Now, initially, when you're writing your problem statement or your significant sections of your project, excuse me, you might find other types of research to explain why chemotherapy-induced nausea occurs, but that's not necessarily a part of your literature review. That's articles that support the problem. So the literature review is separate from that, and you need to critique the articles that you're going to choose to include in it. We'll talk more about literature reviews a little later in the course. Right now, we're talking about critique of each article. There are many guidelines that are in use for critique of articles, such as the PRISMA checklist and Squire guidelines. Readings are posted on our site this week about the Squire guidelines and the PRISMA checklist. There's an online site, a PRISMA online site that gives you an incredible amount of detailed information regarding the PRISMA checklist. I have one in front of me right now, and the kinds of things that are looked at are the title, the abstract, the introduction, methods that are used, which is broken down into numerous subsections, the results that the authors found, their discussion, and also disclosing any funding that they received, because that could cause bias in their results. So many of these guidelines are very similar in nature. For example, they're all going to tell you to look at the title to see if it adequately reflects what the research article is about, the abstract, etc. So use the one that works best for you. Some areas that I examine when I look at a research article, and some of these are things that you might not think about looking at initially. First of all, I read it and I'm like, is this right? Does this sound, like they've done everything in the right way? And if there's some weakness and it's substantial, then I'm going to toss it aside, basically. Is the research problem identified in the article? Do they have a problem statement, for example? Do they have a significance section to show how important the topic is? And does it pass that so what test I've talked about before? Like, who cares? Is this going to make a difference in what we do? Because sometimes research findings are not clinically significant. It's not going to make a big difference in how we do things clinically. So you have to use your logic and reasoning to think about that. Is the research hypothesis clearly stated? So we know we have a research question, we have a research hypothesis, we may have the research purpose, and they all are kind of meshed together in a similar fashion. The research hypothesis is what the researcher thinks is going to happen, versus the statistical hypothesis, where we always say there'll be absolutely no impact of this intervention whatsoever, because we're trying to be unbiased as we start with our analysis. So is the literature review extensive? Do they just have 2 studies that they commented on? They really didn't do the work ahead of time to make sure that they knew what they were doing. And it's funny, as you look through the same topical area, you'll see some researchers even using the same sentences as other researchers have used in their literature reviews previously. So unfortunately, they're plagiarizing and they probably don't know what they're talking about. They just didn't want to do the work. And that will impact the design of their study because we learn a lot from previous research. Is it slanted? I've looked through literature reviews in topical areas that I know an awful lot about where the researcher didn't like the intervention. So they presented, for example, detailed systematic literature reviews where they only presented the negative aspects of every study that they were reviewing. In other words, they're saying there's not one single study that was done right to indicate that this intervention has merit. So even literature reviews can be biased and slanted. Do they use a theoretical framework? Theoretical framework is important because it shows how this research study plugs into theories and knowledge that already exists. So the researcher is building on previous knowledge. When they use their methods, let's say they use the survey, or I'm trying to think of, or some other method for carrying out their study, a phenomenological study where they're interviewing participants. Did they follow the recommended requirements for using those methods? For example, did they have an adequate sample size? Did they do a power analysis to determine what sample size was necessary? Or are we looking at a quantitative study with only 8 participants? If it's a qualitative study and it has 8 participants, that's fine. And that's where research knowledge comes into play, and why as a DNP student, you need to strive to learn as much as you can about research, because you won't know if the findings that you're looking at are reliable and valid. So other areas to examine in a research article, were they ethical? We do see studies that are unethical. And I don't know how they get past IRBs, but you have to remember that sometimes there isn't an IRB if a study's small and it's done out somebody's office or in the community. may not be an IRB that looks at it. So look those situations over carefully. Um, are terms and definitions used correctly and defined clearly? Is the research design appropriate for the research question that was selected? Was the data analysis appropriate? Sometimes researchers don't get the findings that they hope to see. That's not how it should be. We should be biased. Whatever findings we see, we should report them because even what we call negative results inform practice. All results are good results. So, but sometimes what they'll do is they call it fishing for data, or they'll do creative data analysis. That's why, once more, as a DNP researcher, you need to become very well informed on what types of analysis should be done for which research questions, and also, are the assumptions met? Did the authors say the assumptions were met for the quantitative data analysis? Or if we're doing qualitative data analysis, were they thorough? Did they just give a survey and not take on any responsibility for making sure that the data is reliable and valid? With qualitative data analysis, where we analyze words, there's things that we can do like member checking, or have another researcher go through the same analysis and do some comparison, see if the same themes and findings are identified. So you need to follow the recommendations for whatever method you're using for data analysis. And that's why we'll be talking a lot about that in our course. Are the strengths of the study and the limitations listed? It's important to own up to how your research study is limited. And were references cited properly? And what does that reference list look like? Did they use scholarly references? So another suggestion, and this is something that we all do after we get used to looking at research report after research report, is we comb through this article and we look at the title and we're like, okay, that's interesting. I want to look at this. I always look over the authors. What's their educational preparation? Where do they work? Sometimes you'll have an ethics professor, for example, commenting on things that nurses might know more about. So that's interesting. You know, not that we don't need experts in ethics and nursing, but it might not be appropriate for that particular study. What does the abstract say? That gives you a lot of information about whether that study is even of interest to you. I would always recommend to start out with the abstract. If you read it and you're like, oh gosh, this sounds right on target, and you really want to give that article some careful consideration to be included in your file. So I look at in an introduction, the methods that were used, which encompass an awful lot, literally everything that the researcher actually does as they carry out the study, and are they doing these things correctly and with great care? And are the results appropriate, or are there what we call leaps in logic, where they just found this one finding in the study and they extrapolate that to everyone in the whole world and try to apply their results to other groups? For example, if you find that a therapy works with one particular type of pain, like fibromyalgia pain, as I mentioned earlier, that intervention works for fibromyalgia pain, but it might not work for back pain or diabetic neuropathy pain. And we wouldn't want to extrapolate our results or findings and say that it applies to all kinds of chronic pain. We would say instead that more research needs to be done in those areas. So that would be a suggestion for future researchers. And then you come along and you see that gap in the literature and you're like, geez, I'm going to study the impact of this therapy on back pain. because it seems like it hasn't been studied thoroughly on back pain for this previous author. So, what kind of discussion do they have? What kind of conclusions did they make? No leaps. We don't want to see any leaps of logic. And what kind of references did they use once more? And by the way, this is worthy of mention. You can use those references, chase those down, and see if you get any ideas about the historical development of the problem, or if they're newer references, you've just been given a gift there because this author probably combed through all the literature already, found the best references that they could find. And so you can use their reference list to chase down references as well. So please read the documents posted this week on different systems that are used to critique the individual research reports. And of course, I'm referring to the PRISMA guidelines and Squire guidelines. But note that for your assignment in this course, I have asked you to use a list in your Allison Terry text, 3rd edition, to use a certain list that's in there as you critique 3 articles for a project that you have in here. So thank you, everyone. Remember, read and learn. Bye-bye.